Hi, I'm Dr. Sonal Kumta and I'm the consultant obstetrician and gynecologist practicing at Fortis Mulund. As we all know, August 1st to 7th is celebrated as the Breastfeeding Week, and this is done to encourage breastfeeding and improve the health of babies all over the world. Breast milk, as we know, is the best nutritional food for your baby with unparalleled immunological and anti-inflammatory properties. Though breastfeeding usually starts after delivery, it is important to know that the preparation for breastfeeding must start in the antenatal period. When we see our patients antenatally, it's important to examine the breast and look for any retraction or flat nipples. In the postnatal period, we encourage rooming in of the baby. In case of normal deliveries, we encourage the breastfeeding even before suturing of episiotomy. In cases of cesarean, we encourage breastfeeding at the earliest. We prefer a policy of zero formula feeds for the babies. We encourage mothers to breastfeed her baby on every demand or at least at 2 to 3 hour intervals. It is important to remember these tips while breastfeeding. Breastfeeding should not be started after the baby starts crying. It is important to initiate it when the baby shows first signs of hunger, that is, some activity or mouthing or rooting. There are certain special situations like multiple pregnancies, for example, twins. This patient is very worried about how she will be able to feed both her babies. I counsel my patient by saying that the breast secretions are going to be sufficient for both her babies. Breastfeeding is often dependent on sucking, and more the sucking, more the breast output the patient is going to have. Either the patient can breastfeed her children one after the other, or she can breastfeed both the children together using the football positions. Some other situations like prematurity also pose a problem for breastfeeding. I tell my patients that even though they have delivered before time, the breast milk that they will secrete is going to be right for their premature baby. These babies are sometimes in the NICU and cannot be given feeds directly. In such situations, the patient can express her breast milk and give it via nasogastric tube. Sometimes these babies tend to get tired very easily, and the patient can express and then feed the baby. I would like to end by saying that breast milk is nutritionally the best for your baby. It prevents infections. It is readily available. It has lot of health benefits for the mother, and it is responsible for a beautiful emotional bond between the mother and the baby. Breast milk is the best for your baby.